So, thank you for joining this talk. I've been really looking forward to this because this is kind of my baby, and I think we're going to take the research and how to read it and dig a little bit deeper into that, and maybe I hope I'm going to be able to show you that if you don't read the research properly, you're going to miss some major points, and specifically the clinical parts of it. And I'm also going to spend a lot of time talking about this exact question: what are the most common injuries in climbing? Because that's actually not very, yeah, you'll see what you end up with thinking when when the lecture is done. I think maybe you're going to change some views then, because the most common injuries in climbing, it really depends on several factors, like what kind of climbing are we talking about? Is it an acute injury? Is it a chronic injury? And definitely whether or not the classification of injuries is specific enough, or is it broad enough? Is it too broad? How do you classify the injury you're researching, and who tells that it's an injury? Is it the climber? Is it the clinician? I mean, these things will change how it's reported. And also the population will what's the most common climbing injuries will change. At least I think it does. In my research, I find that it's really dependent on gender, and maybe also age group, and definitely on level of performance. And actually, the source of information you use to find the information will also affect what you will see as the most common climbing injury. And I'm going to talk a little bit about that as well. And definitely, is it paraclimbing we're talking about? Then it's the whole different game. So it's not very easy to answer what is the most common injury in climbing. And one of the reasons is because I don't know if you're familiar with this one. It's the way you group or kind of put the research in different parts of the system. And in climbing, there's not many systematic reviews at all. I think there's only one, maybe for younger climbers, I think, a couple of years old. Synthesis and guidelines, we don't have at all. There's a few coming, I think, from the psychological research team. They have something coming, but they didn't want to publish it as a scientific research, but they still made it the proper way. So I think they have something. And then, so what we're left with is level 3, the critically appraised individual articles. There's a few of those that is being used a lot in and referenced a lot in other research. I think there's only a few randomized controlled trials, and that not in injuries, but in performance. There's a few. So what we actually have is the cohort studies and the case series and reports, which leaves us with level 4 and level 5 evidence, and that's really low. It's really low. And also the right-hand part of the screen now is the factors that deciding the quality of the evidence, and definitely the factors that decrease the quality of evidence is the limitations of the studies, and the how many participants is it, and climbing research is predominantly with very few participants. There's a few studies with more than 200 participants. So actually we're kind of struggling with the research. And I also wanted to bring in this little picture, because maybe it doesn't matter that our level of evidence is so low, because it's still not, I mean, they won't die from our bad research, will they? So it's maybe it doesn't matter, maybe it does. We'll see. So as we are left with the register studies and the cohort studies, I figured we could talk a little bit about the how they are performed, and how they are, what's good with it and what's not so good with it. The registered studies are usually performed with either there's a few national registers which are really good, huge ones, but they're not for to be used for climbing. But we have in Norway we have a few population-based register studies with I think like 50,000 participants or something, that's been followed for 30 or 40 years. So they have really good data coming from those. But we don't have those for climbing. So what we are left with is the hospital registers and a few organizations that are contributing to this research. There's a few limitations that we need to take into consideration when we are talking about the register-based data. And one of the main limitations is that it's pre-coded, and it's really depending on who has done the oops, did I hit the wrong button? Can I still see the PowerPoint?
Yeah.
Yeah, okay. Sorry. And a lot of the registers are also depending on whether or not the people who are entering data to the registry are entering the relevant data and enough data. So we are usually left with low data quality, and so the register data, it's maybe not the best anyway. The other and what I have been using a lot is the questionnaires, and they are, in my opinion, they're good use of information, but they can't be used to say so much about what kind of injury we have, and that's kind of it's I mean, I have been talking about climbing injury in my research, but as you can see, the questionnaires are maybe better off talking about symptoms and not the injury themselves. So I have been trying to write a paper about the difference between pain and injury, and how this affects the research. but it's taking me now 2 years. I think it's a really hard paper to write. But the thing is that we usually talk about injury a lot, and climbers, the way climbers talk, they say, I have an injury, I have a finger injury. And we say, yeah, how do you know? Have you been to the doctor? No, no, no. But I know, yeah, it's a pulley injury. But yeah, right. That's what they all say because that's what they heard about, isn't it? So I think we should maybe be a little bit careful about how we use the term injury, and maybe we should talk more about the pain because I have finger pain. I'm going to talk a little bit more about that later, but I just got carried away. Sorry about that. Thing is, the pitfalls with questionnaires is obviously the selection bias. I mean, who can see it and who will answer it, and not to talk about those who are not answering it. Why are they not responding to the questionnaire if they see it? Is it because it's not relevant to them? Maybe they don't have the time, maybe they don't for almost all of the research performed with questionnaires on climbers have the huge amount of climbers in the middle of the performance spectrum. There's very few beginners and there are very few high level climbers. And I think that's definitely because somebody are abstaining from responding to it for some reason. And questionnaires, they have some responder bias. That's for all questionnaires. There's almost always more females answering than males, except for climbers. The climbers are predominantly answered by males, so for some reason. Mm. And for a questionnaire nerd like me, that's really, really, really weird. That hooks my noodle a bit because it shouldn't be like that. All older questionnaires are predominantly answered by female. And it's literacy is a pitfall because they have to understand what you're asking about. They have to understand the questions. And sometimes for larger questionnaires and psychological measurements, there's and also for nutrition, there's so many questions that they sound almost like the same, and they are almost like the same, and we need people to answer all the questions, but they look like it looks like you're answering the same question over and over again, and then people are leaving and they quit answering, so you lose the respondents. So there is a huge responder bias in the questionnaires. So I wanted to show you a little bit how you find the relevant research, and I hope nobody from the Trump administration are listening to this because we really, really, really need the PubMed to continue to exist. I think the research world will. Actually, some years ago, the PubMed was closed down for I think it was 2 weeks or something. It was horrible. We can't have that happen again with disaster. So I'm using PubMed a lot. I think that's a good starting place. And if you want to learn something about, say, now I'm going to talk about climbing injuries. So of course, as you see, I search for climbing injuries. And this search was done the 7th of April this year. And I changed a little bit. If you see the screenshot is with a research span of 5 years. I changed it to 10 years because 5 years was a little bit too short. So then number of results if you don't shorten the research window will be like almost 1600, and the last 10 years it's only 853. That's not too much. So I scanned all the titles because I need to know what's behind and what did I find, and based on the titles, there was 444 papers that was obviously wrong. That had nothing to do with climbing injuries at all. I mean, they were climbing ladders and all kinds of stuff, stairs, and yeah. So, and there is probably something that I'm interested in 19 papers, and probably wrong in 37, but still I have to read the abstracts to make sure that I'm not excluding some papers that I could find relevant information in. So then I was left with 14 papers to read based on the abstracts, and then I needed to start reading the research. And so we will get back to this literature search later, and after I've told you how you should read the research, because that's I think maybe you've been doing it wrong. I'm sorry. So as you see this, I don't know if you feel familiar with this, but reading the research the usual way, then you read the abstract and you read the conclusion. And if there is any time left, you check out the introduction and maybe the discussion. If and kind of I have a feeling that's it. And most people stop there. And I listed the way I read the research on the other side, and you can see it looks a little bit different. So I read the abstract first, always, because that's how to find out if the research is relevant. And then I jumped straight to the methods to see how did they do this? It's how did they get to the data they came up with? And if I think the methods is good, then I skip to the tables and check out the tables. And the reason why I do that, I'm going to show you later. The tables, they kind of, it's a secret good part of the research. The tables have, that's where all the good stuff is. And then I look at the strengths and weaknesses to see if the researchers are aware of their own pitfalls and see if they understand the possible flaws with the research, and also if they're overselling it. Some researchers they get really high on their results and they really they make too much of it. And then I go for the introduction to see if they are using the relevant and up-to-date research to kind of back up their own research. And then I see look at the conclusion, and then the discussion, and then the additional material, and then after I've done all that, I have been looking at most of the paper, then I'm reading the full paper from top to bottom. Because when I've looked at all the elements I want to look at, then I can see if the full paper is what it is. So when you read the abstract, you should, of course, the first thing you should look at is whether or not the research is relevant for what you need. If not, you could just throw it away. And it's also useful to see if the research question is a good research question. And in my opinion, a good research question should never be possible to answer with a yes or no. Because if you have a yes or no question, you don't need the discussion. Are finger injuries the most common? Yes, done. So and then you could see how are they going to answer their question? How do they find the data that is going to answer their question? That's the methods again. And then maybe the most important is what's the outcome measures? Is the measures relevant to the conclusion? And sometimes it's actually not. If you look at the measures and you look at the conclusion, then sometimes it doesn't add up. And then that should ring a bell and some lights in red should pop up. So what I have done is I've taken the liberty. I mean, since I'm doing this lecture, I could take the liberty to use some of my own research for this. I was actually thinking that I should take a paper I have been a reviewer on and tell you everything that's wrong with it, but I find that kind of obtrusive. I didn't want to do that. So instead, I'm going to tell you a little bit of how I've been making my paper and also maybe overselling it because I think it's a really good paper that everybody should read, of course. But I'm also going to show you what you can find in it if you and what changes if you read it differently than maybe you have been doing before. So this is a paper from last year, and as you can see, this is the abstract. And luckily for me, the BMJ they are really strict with how they want people to write their abstracts. So this one is you can't. It's almost impossible to mess it up actually. Luckily for me. So I think this abstract is kind of fits the topic. Well, because what we're trying to answer here is what's the most common climbing injury. So this paper kind of fits the object. And when you have looked at the abstract, you're going to take a look at the conclusion. And then you should also, if possible, you should also check if the conclusion is the same in the abstract and the full paper. Sometimes the abstract it's very limited in how many words you can use, and sometimes the conclusion is expanded in the full paper. So that should be sometimes it could be good to have a look at. And sometimes the conclusion is where the researchers are really overselling their research. They kind of blow it up to mean something, and maybe they stop, look at their findings, and because they have something they want to tell. They want people to know this, and they want to say it out loud, so they put it in the conclusions. But it has maybe nothing to do with the findings they have in the paper. So this is the conclusion from my paper. Over 50% of the climbers experienced an injury in the past 12 months, and different for women and men. Differences between genders, injury site and prevalence, and the gender differences may be affected by the aim for training and the style of climbing. So it's really short, and in this paper, it's the same conclusion in the full paper and in the abstract. And as far as I'm aware of, there's nothing added. I mean, this is really the short story and the main findings, period, and nothing more. If you have read the paper and disagree with me, please let me know. And then we jump over to the methods. And this is what you should look for in the methods. Definitely, what is the population? What's the research population, and why is this population of special interest for the research? And the methods should also list clearly the inclusion criteria and the exclusion criteria. And the exclusion criteria is usually more interesting than the inclusion criteria. What's also very important is where and how they found the respondents, because it may differ a lot if it's just, is it one climbing gym? Is it two climbing gyms? Is it something special with these climbing gyms? Is it something special with the region where the research has been conducted? I mean, one of the main names in research is Volker Schöffel and the Bamberg Social Stiftung. I'm not sure of the full name of the clinic, but they are in Frankenjura. And what's very specific with Frankenjura is they climb on pockets, 2-finger pockets and 1-finger pockets, and that maybe makes the injury spectrum different than if you climb in Yosemite with crack climbing. I mean, they don't do the same. So you need to look at where do the respondents come from? Does it affect the results? And then if possible, the dropout rate should be stated in the methods, because it says something about how intrusive is the research. Is it and if the dropout rate is high, then alarm bells should be ringing. Then there is something wrong with the research. Of course, the statistics should have a look at the statistics, and I completely understand it if that's maybe it's not your cup of tea, but you should have a look at it and see if it's really difficult and hard to grasp statistics, because then maybe they have done some funky statistics to get the results they want. So the more funky the statistics is, the more you should look at, and the more careful you should look at the results. Have I done it myself? Yes, I have. We did some really funky statistics and we got some really good results. So yeah, I have been doing it, and you should be aware of it. Take a look at the statistics, even if it's not what you usually do. And for injury, and then the outcome measures, of course. What are they? And why have they chosen these outcome measures? Because and also sometimes you can see if it's a questionnaire or if it's a registry-based study, you can see that they have been picking out only a few outcome measures out of a huge pile of possible outcome measures to look at. And then it's again, it's maybe more important what they don't look at. It might be more important than what they actually do look at. And then the last one is the definition of injury. What are we looking at? Is it chronic injury? Is it acute injury? Is it self-reported? Is it reported by health personnel? So this is what to look for in the methods. So in my paper, Jared, just to make sure, how long do I have? An hour?
Yeah, an hour total.
Okay, shit, I have to speed up a bit. Okay, so this is again from my paper, and it's a cross-sectional survey. It's an item-driven questionnaire. It's kind of a funky way to do questionnaires that I like to do. The period of inclusion is short, which means that the shorter the inclusion period is, the better, because then nothing changes in the world or while it's been performed. Yeah, and and as you can see, there is no funky statistics going on in this one. It's really easy statistics. And then the tables. This is really, I can't underline this enough. You really need to look at the tables. It is the main source of information, and there's usually more information in the tables than in the rest of the paper. You can find usually you find some hidden findings, findings that's clinically relevant for you, but maybe not discussed in the paper because it's not the most interesting parts academically. And also you can find the findings that the authors didn't discuss for some reason, something and that may only be because it's not what the researchers are interested in. Maybe they are interested in the academic part of it, not the clinical part of it. So that's where you should look at it. And in this paper, there's a lot of tables, and I've circled something for you here. And if you look at the top first, you can see that the ankle injuries for women and men, they differ a lot. Women beginners twist their ankles. Male high-end climbers twist their ankles. So it's completely opposite. So injury prevention in these groups should be different. And the same with the shoulders. It's exactly the shoulders and fingers. The spectrum looks very, very similar if you look at beginners, women 16, intermediate 29, advanced 14. So we have a perfect bell-shaped curve for the female. For the male, 7, 31, 32, they just keep going. And for fingers, it's even more. It's even better. The bell shape of the female curve is slightly different than for the shoulders. For the men, I mean, it's horrible. The harder they climb, the more they have pain in the fingers. They don't learn anything. And this is not discussed in the paper. This is only in the tables. So you need to look at the tables. And also this one, it's a horrible table. It's so much information in it. So, but it's what we have to do to get it in there. But what you can see here, if you look at it closely, is that the report of injuries differs whether you ask them to report their highest level of performance in route climbing or in bouldering. You see that? They differ quite a bit. So if you answer the low level route climbers, then the the number of injuries is 24.5%. Low level bouldering 4%. So it's a huge difference. And then you can start wondering, why is it like this? What's going on? So in the strengths and weaknesses, it's just have a look at it, and I think maybe this is more interesting for the academics, because you really have to kind of think academically to see if they have discussed it, but they should discuss some of the things I talked about in what you're supposed to look for in the methods, and specifically where does the respondents come from? Are they aware of anything that makes their respondents differ from the normal population? So in this, yeah, it's really not very interesting. And then the introduction. It's what's the scientific base, which research is cited and why, and are there references up to date, and do they use the relevant research? And that's I think that might be a hard ball for you to catch, because then you have to know, you have to be using the research and reading research a bit to know this, but have a look at the reference list and see, is it outdated? Does it look odd? I mean, is there something strange going on there? You just have a look at it. And also, there should be a clear red line from the start of the introduction to the research question. It should be, they should fit. Yeah, I'm just going to skip this one. You're going to send out the PowerPoint later, Jared, is that?
Yeah, if you're okay with it, I could send the PDF in the follow-up email to everybody.
Yeah, sure, that's good.
Great.
Because then I skip this. And we go to the discussion, and that's where you can see, do they discuss the right findings? Is the findings compared to the relevant research? And again, this is, you need to have a look at the reference list, and you have to see if there is something missing. And also, you should be doing some tests. Look up some of the references and see if the references actually are used correctly. The last paper I was reviewing, the main reason for me to reject it for publication was that the reference list was completely arbitrary and strange. They had obviously no idea what they were talking about. They've just been picking things around. And what some researchers do, they see that if I'm citing something in my paper, they just take the citations that I've been using and reuse them without reading them or checking them if they're relevant for their research. And when you have done that a couple of times, then it's rubbish. So you should have a look at it. And also how the discussion is structured, I think that's actually relevant, and that's why I read the discussion as a separate part, because sometimes the discussion is so badly structured that it's difficult to understand what they actually are discussing, and if they're discussing their own findings, or if they're discussing something that they find interesting but they haven't researched, and all kinds of stuff is going on in the discussion that you should be aware of. And again, this is how I'm trying to structure my discussion. I usually structure the discussion and as the same way as I'm structuring the results chapter. So you can see the results are presented, tack, 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 tack. And then you can go from in the discussion from the top of the first thing mentioned in the results is the first in the discussion, and go up and back, because then it's easy to scroll up and down and see if it's easy to use, and if it's everything is there. So it should be easy to see if I've missed something, or if I'm overselling something. And this is what would be lost if you don't read the discussion properly, because this is not in the conclusion at all. There's a huge rise in knee injuries for the male climbers, and also the wrist injuries for male climbers. And also in the discussion, I tried to have some clinically relevant information, but it's difficult with research like this, because I try to cover so many topics that it's too many words. I had to cut this paper in, almost 40% of the paper was cut in the production. So that was harsh. And again, this is also things that it's not in the conclusion, but it's only in the discussion. So now, when we have gone through my paper in the way I usually look at research, we should again visit this question. What's the most common injuries in climbing? So we had these 14 papers that was picked out of 580 something papers. And what's obvious with these 14 papers is that they use different methods, they study different populations, they have different scopes, and maybe they are discussing different sports actually. So if we are saying that registered studies, they have a higher level of evidence than the others, okay, then ankles actually are the most common climbing injury, because it's only one study the past 10 years that is a registered study, and they have it's Austrian, I think, hospital with a couple of hundred climbing injuries, and among those injuries, ankles is the most common one. So maybe ankles is the most common climbing injury, or maybe it's the shoulders. In here we have there's 3 papers. Okay, 2 of them are mine, but still there's 3 papers suggesting that shoulders are the most common injury. They come from different 40 plus different countries. It's self-reported, so that's a huge pitfall. And it's also the paraclimbing. So yeah, maybe shoulders is the most common climbing injury then. Or feet maybe. And because this study might be the best quality study performed for the last decade. It's a really good study because they combine questionnaire with medical examination. So in this paper, 70% of the climbers had an injury to the foot, and 70%, that's a lot. It's really a lot. So maybe feet is the most common injury. But then again, they had alterations. They had and alterations is per definition an injury. An injury is a lexical definition of injury is that it's an alteration of the structures that can be found on images or via tests. So they had injuries per definition, but they didn't have any pain. So maybe fingers then. Fingers are found to be the most common injury in a registered study, but again, that's from the Frankenjura, and it's and the first author is a finger injury specialist. So using his hospital registry maybe isn't the best. And in self-reported, it's the most common injury if you look at all climbers as a group and don't separate it from gender. And there's also one registered study that's sold in as a prospective study. It really isn't, but as I said, they're overselling it from time to time. So if we are looking at the based on the level of evidence and hierarchy of decision making, then feet is the most common place to have an injury for climbers, or ankles as a second, shoulders as third, and fingers as a fourth most common site of injury. And I don't think that's how most people are thinking of climbing injuries, is it? If we look at the epidemiology papers, then fingers are the most common injury for male, shoulders for female, followed by feet as the third, and ankles as the fourth. But then it's predominantly self-reported questionnaires, can it be? And it may not be trusted. One thing I should say is that the paper painfully, no, not this one, sorry, top of the podium, which states that shoulders is the most common injury. Then all the participants had been to a health personnel and have it diagnosed, although that was not a specific inclusion criteria. So I think to make use of this research, you need to use this nice little figure. You should look at the person in front of you, and you should ask yourself, what kind of climbing is this person doing? At what level? And where? And then you can start help them either prepare and prevent injuries, or you can get them back into the game at the correct level before you let them start.